Hi, my name's Lee MacDonald. I'm an interventional cardiologist here at South Denver Cardiology. One of the most common valve problems that we encounter in patients is something called aortic stenosis. Aortic stenosis is thickening of the aortic valve, which lets blood out of your heart. How do you know if you have this? Most people, the way we discover this is when we hear a murmur. It makes a specific sound when the blood passes through this valve. The aortic valve, when we're born, in most people when it's functioning normally, opens and closes without difficulty. But if you can imagine an aortic valve having to open and close every second of your life, every minute of every day, while you're sleeping, while you're exercising, while you're doing everything, it's opening and closing. Through time, that valve can start to get thickened, and eventually it can become stenotic, and that's the description where it stops moving as freely. Most people at the beginning can live with aortic stenosis when it's mild or moderate without any symptoms. But when it progresses to the point where it becomes severe, oftentimes it can cause symptoms in patients and cause them to feel poorly, and that's when we obviously would like them to be seen by a cardiologist. So aortic stenosis, a thickening, or basically when the aortic valve, which lets blood out of your heart, doesn't open well, people with severe aortic stenosis typically start to develop symptoms. The symptoms that are common are shortness of breath or signs of heart failure, including leg swelling or difficulty with exercises or things that they used to be able to do without difficulty. Chest pains or chest discomfort. And then the last one is passing out, dizziness or lightheadedness. Those are the three common or severe symptoms that we are concerned about with people with severe aortic stenosis. How do we find out if patients have severe aortic stenosis? The most common way is with an echocardiogram, an ultrasound of your heart. When we do that, we can make measurements and see exactly how the valve is functioning. So that is the most common way that we do that now. There are rarer times where we do more detailed testing or invasive testing, but in most people, an echocardiogram, a simple ultrasound of your heart, is what allows us to discover if you have the aortic stenosis. Severe aortic stenosis with symptoms, when a patient develops symptoms and has severe aortic stenosis, in those patients, in most cases, we recommend, if they are wanting to continue on, because this is a very serious situation, that they have the valve replaced. There are two different main ways to do that right now. There is open heart surgery or surgical aortic valve replacement, and something called TAVR, Transcatheter Aortic Valve Replacement. Believe it or not, we can actually put a new heart valve in through a small tube in your leg while you're awake, and people can go home the next day. TAVR is indicated for people with intermediate or high risk, who are intermediate or high risk for surgery with aortic stenosis, severe aortic stenosis, and surgery is recommended for all people if they're candidates or need their valve to be replaced. One of the exciting new procedures for people with symptomatic severe aortic stenosis, this includes people at intermediate risk of surgery, high risk of surgery, is something called TAVR, Transcatheter Aortic Valve Replacement. Believe it or not, we can now put a new heart valve in through your leg, through a small tube in your leg about the size of a straw. This valve can then travel up inside this tube all the way into your heart. And in this instance, this is what you're seeing right here is this blue thing is about how the valve is taken up to your heart, this blue tube. We then take this into your heart, and here this is showing where the balloon is open. We can then expand the balloon, and this is showing that the balloon is inflated at this point, and we can stretch open a new heart valve inside your old heart valve. This is a section of a heart that has been cut away, so you can see this new valve could go inside of an old deficient valve. The amazing thing is patients can be awake while we do this, and in general the recovery time is fairly quick, so it's amazing that we can actually replace this through a catheter in your leg. There are two different types of valves that we use. This is a model of one, this is a model of the other one, and again, it's a real exciting area in cardiology at this point for helping people with severe symptomatic aortic stenosis.